Thanks for staying with us. So joining us now is a renowned Nigerian actress who has made significant impact on Nollywood industry. In May 2024, she was appointed by the U.S. Agency for International Development, as USAID, as the Goodwill Ambassador for Nutrition. And is in this role, she's raising awareness about maternal health and child nutrition in Nigeria and beyond. Welcome with us, Chioma Akpota in the building. And joining us also is a nutrition management specialist in the U.S. Agency for International Development, as USAID Nigeria. He has nearly 20 years of experience in community and public health nutrition programming. Welcome with us, Ebenezer Oluloto. Welcome to the show.
The clap gone silent now.
So let me start with Ebenezer. So can you tell us why breastfeeding is such a critical issue at this time?
Yeah, thank you, your view team. And then thank you again for the privilege to be able to share our perspective with you. And I also appreciate the mission leadership for supporting this initiative. And of course, congratulations to Nigerians and mothers across the world, for the occasions of the World Breastfeeding Week 2024. So breastfeeding is a gift. Let me start by saying that, to humanity, because it contains all the nutrients, all the rights in the right amount for the child, and it had enormous benefit for both the mother and the child. So if it's practiced as recommended, in early initiation, breastfeeding starts 1 hour, just within 1 hour after delivery, and is done exclusively for 6 months without water. And then after 6 months, we know breast milk will no longer be sufficient for the child, and such child needs to now move to continue breastfeeding, plus what we call appropriate competitive food up to 2 years and beyond. If this is done, there is enormous benefit. It saves lives because it contains all the antibodies that the child needs at that particular age. And you also know that children systems are not like fully mature, developed to handle a lot of things like food, waters, and all that at that early stage. And so the immunity that the child needs is gotten from the breast milk, and it forms a defense. Like colostrum, for example, also help to expel the black stool from children. Right. I'm sure people in the studio they're more experienced than myself because they practice it yourself. Yeah, but so there's so much benefit to the society. It's also save money because you don't have to be paying money for infant formulas and things like that that cost. So it's a pocket friendly as well. And of course, very good for the child.
Yeah. I'd like you to also answer the question about the benefits of, because he's a doctor, but you as a mother, what are the benefits of breastfeeding?
First of all, for now, in the economy, is cost effective. At least the first 6 months, you know that you just relax and make sure you eat good food because the baby is gonna be fed well, But most importantly, there's this, you bond with your baby. Exactly. Beyond the first 6 months of breastfeeding and, for the first 1,000 days of the baby's life. You bond with your baby. The baby knows you very well. Nurture. That's what nurturing is. For me, that's one of the most important benefits of breastfeeding: the bonding, the cost effectiveness of it, and the giving the baby the right nutrients that help them build the immune system and just make them stronger and they think better. When we're small and you behave anyhow, someone just say, you be like say you drink to mama breast. Not soft breast. You be like say you soft breast well. So all of those things.
So what are the unique challenges Nigeria faces in promoting and supporting?
That is Oga's question.
Yeah, I even wanted to ask
to deal with data and
I wanted to ask him. This year's theme is closing the gap, breastfeeding support for all. Can you explain what that theme means exactly, and the significance of it?
Thank you. So basically, it's saying we should leave nobody behind. As we said, breastfeeding is important for everybody, for the child, for the mother, and for the practicing mother, for lactating mothers. The mother requires a right environment and the right support, other education, counseling, access to healthcare services, and all that is required, even in terms of access to food, to well-fed, for example, or maybe a workplace flexibility and time to be able to focus on the child. What this year team is looking at is how do we ensure that that happens? Whether you are staying in Ajikule, or you are staying in Banana Island, or you are staying in Maiduguri, in IDP camps, or you are staying in wherever, but you have access to all that's required for you to be able to optimally breastfeed your child.
Yeah.
That's required, yeah. So that's basically what the team for this year is: leave nobody behind, give all the support that is required as needed, equity for all.
Right.
Okay, so what are the unique challenges Nigeria faces in promoting and supporting breastfeeding?
Okay, do you want me to go?
Yes,
Yeah.
go ahead.
Okay, yeah, thank you. So most challenge we face in Nigeria, average Nigerian mother breastfeed. You will agree with me. But how do they breastfeed? You realize that 33% of the mothers in Nigeria breastfeed their children exclusively. Recommendation is for the children to be given breast milk only for the first 6 months. But we have challenge with the water. Many caregivers or many people have not been able to accept the fact that breast milk is sufficient for the child for the first 6 months. So you see, like 40% of the mothers also give plain water along with breast milk. So imagine if you can take out the water. We'll talk about zero water campaign. We'll be able to have up to 73% of mothers in Nigeria breastfeeding their children exclusively. So that's one major issue. There's also challenge, with policies and programs that are geared to support breastfeeding in terms of flexibility, hour, for example, in terms of maybe 6 months, recommendations and advocacy have been making for, maternity leave, and even maybe a few weeks paternity leave for the father to provide the support, because you realize that, you people who have the experience, so how difficult it is in the first maybe few weeks, for the mother. And if this mother is going to be the one that will cook, do all the household chores, take care of other children, it becomes much more challenging for her to be able to do all this. And so the support that she requires is needed both at the facility, at the community, and as well as the household level is concerned. All that are part of the challenge that women face in Nigeria to breastfeed ultimately.
So what role is the USAID undertaking to support breastfeeding and improving child nutrition in Nigeria presently?
So USAID has been, supporting, promoting, and protecting breastfeeding for many years across the world and in Nigeria. And part of the work we do is to work with governments, like we are celebrating this World Breastfeeding Week. We work with our partners, those either through funding or technical assistance, to ensure that there is the right message, there is a job aid, for example, to health workers, the right training to be able to deliver quality service, by the health workers into these mothers. And we also ensure that we invest a lot of resources in behavioral change, interventions, trying to support the mothers to be able to breastfeed exclusively and to also do appropriate competitive feeding with breastfeeding for 2 years. We also have strategies that align with that of the government. And so most of our role, either in development context or in humanitarian context, has always been looking at focusing on that mother and the child as our priority. And how do we ensure that the environment is conducive for her? And all the investment we do, speak to, address this challenge that the mother faces to breastfeed her children. Yeah.
Okay, so this question is, I have a question more from the entertainment industry, because I'd like to find out from you, Chioma, what role do you think the creative industry the creative sector can do to encourage breastfeeding? How can they promote it? How can they ensure it gets to more people, the awareness spreads?
Simple storytelling, actions speak louder than words, right? And then, this thing we do in school, you have to do theory and then practical, right? There's so many beliefs that Nigerians have against breastfeeding that we need to educate people on. And when they see it, if you make a movie today, it outlives you, right? And if you tell the story, put out messages, people get to see it time and time and time and time again, right? So that's how I come in, and that's where the creative industry comes in, to tell the world, to tell women that, there are so many benefits in breastfeeding, not just, some see it as a duty. Yes, it's your duty, but you have to enjoy it. It's your time to bond. It's your time to create. It's your time to know your child, even know yourself. You know, so all those norms that are against breastfeeding, that's how, that's what we look forward to changing through our storytelling.
Let me talk about support system. I'll come to you, Chioma, because what kind of support system do you think mothers need? Because someone like me, I have twins, and she had twins. It was difficult to breastfeed.
Oh, wow.
How do you breastfeed 2 children in the first 6 months? So, I mean, when women are overwhelmed, what kind of support system do you think we can help to encourage mothers to breastfeed regardless of how many children you have?
I mean, support system from family, from the government, creating better work environments where, you know, the mothers can take time out to go and nurture their kids. And if not nurturing them at the workplace, extending their maternity leave, pay them whilst they're doing that. Because if you say you take 2 months maternity leave or 6 months and you don't get paid, you won't encourage that mother to have another child.
Exactly.
So after this one, I'm done. Now I see money, raise this one. Do you understand? So, and then if you have support from family, from relatives, or from your partner, most importantly, you have twins and you're breastfeeding both of them at the same time, you can say, okay, let me hold this one for you and, you know, help whilst you breastfeed this one and nap, or you express and I feed this one when, you know, there's support from, you know, everyone. Relatives, sisters come to help you, mother, or mugwo, you know, when your mother comes to help you, to support you, because sometimes it's really overwhelming, you know, nurturing a child. But when it's a process where the mother finds herself and finds the baby as well. But if you have support, it becomes really, really easy, you know, to navigate your way through it.
So, Ebenezer, I want to add anything to that, to support system?
Yeah, I mean, I was just smiling because I know that it takes a lot for a mother to breastfeed. And I can say from my own personal experience, I have 4 children. All of them received exclusive breastfeeding for the first, 6 months. And I was there for my wife, you know, to help with other children, for example, help in the household chores, and we get that as part of the support. In terms of also counseling, you realize in Nigeria, mothers don't have access to counseling, quality counseling at their facility. Like 50% of the mothers in Nigeria have access to quality counseling. And you have cut across, even private hospitals, people don't really know much about the importance of breastfeeding. And that's why, you know, we are scaling up this discussion to cut across so that more people, you know, can get away and they also can get behind supporting mothers to breastfeed their children optimally.
Now that we call quality counseling busybodies, you know, this generation of mothers do not appreciate the advice the older generation give anymore when it comes to, you know, how to care and nurture and cope with. I had to cope with mothering. It was a total switch for me. I couldn't cope. I had health issues. I had postnatal issues. Oh, wow. And I cannot underestimate what a support system can do. I'm entirely grateful to the one I had for my second child. Yeah. But now we call it busybody. So I don't know. What would you say to that?
Well, if I may comment, no man is an island. And when you find yourself in that situation, like mothers and all that, you need support no matter what. All these things that they're saying, busybody, it will tell at the end of the day, you know, your mental health will be thoroughly challenged. I can guarantee you that, because I had stress after. I didn't have before, but I had after delivery. I lost a lot of weight because I was always awake. I was so scared. What happened to this child? I'm the custodian of this child. You know. So my mother was always there for me. My sisters came around. You know, my in-laws were there to support. You know, so you cannot underestimate support. You cannot. I mean, you have to have support. You know, and for those, you know, for those who find themselves around situations that they don't have support, I pray that they find support somehow. You know, teenage mothers, and you know, there's a way they ostracize them and say, no, you had a child out of wedlock and blah blah blah. Deal with it. Those were the ones that I yearn to help if I find anyone around me, because it makes a whole difference where they find support, because they're so sad and so disturbed mentally. They don't show it, but if you search deep down, they would just, any little help, you just feel that, you know, they just yield towards you and all of that. So,
Okay, so what kind of support do mothers need to successfully breastfeed, and how can communities and healthcare systems
You already answered that question.
Yeah.
You already answered that question. So number 9, that's
Okay,
where
what message would you like to convey to policymakers, healthcare providers, and the general public about the importance of breastfeeding and the need to comprehensive support system? Dr. Ebenezer, are you still with us? Yeah.
Yeah, I'm with you. I was waiting for you to finish. So basically, everybody has a role to play. Government at the center, government at the state, local government, and now they have autonomy. So they have more money to spend to support, mothers and their children at the grassroots. So basically, there's a need for, support system at the family level. The government needs to also fully implement what they call the breastfeeding policies, where some of the things we're asking for. I know some states, maybe like Lagos and a few other states, has started giving 6-month maternity leave, for example. But that needs to cut across, because we're talking about leaving nobody behind and filling the gaps. So part of the thing we're also asking for also is for health workers, to be really adequately trained and prepared to be able to provide this support. And I'm glad that the government at the center is also taking initiative. They had gone out to start training about 120,000 primary healthcare workers, which are also supporting, to be able to have at least like a refresher to know what to do when they come across, mother and their children, or when they come for delivery. Our antenatal service needs to be more robust, and we also need to take it further beyond the public health facilities. Many people go to the private health facilities and they don't get to hear about this. And so part of the thing we'll be looking for is to see how we can have like a uniformity in terms of package of services that mothers and children receive when they go to health facilities, especially as regard, counseling for breastfeeding.
Thank you so much. But Chioma went into an angle that I feel that we could just dig deep a bit on, because people, underaged mothers tend to get ostracized. They tend to have to do it because it's like a punishment. How can you carry belly? You don't carry belly, you are left alone. And they are having to deal with a whole lot of emotions that come with being pregnant and breastfeeding. And it's now a sad experience for them. And I love when you said that you would love to support these people. And I think as a society, we should start changing how we deal with people like that. If you see someone that is underage and pregnant, give that person your own love and support. It might help. And I know you wanted to even mention some other categories.
Yeah. Some other, the list goes on and on and on. I mean, some mothers who were raped, some who found themselves in very compromising positions, and, are left with nurturing a child that they wanted, but not at that time. There's so many angles to this thing. If we can find one, each one which one, you never can tell. You're there ostracizing them that they were bold enough to keep the baby. What if they aborted the child? You say, that one did this. So well, on one day, this person has told you that I want to keep this child. I don't want to, get rid of this child. So let's support in the best way we can. And then this breastfeeding week is just the best time to tell people that, mothers need all the care and support.
So what other activities is USAID going to be doing this week to celebrate, to commemorate the breastfeeding? What other activities?
On the 1st of August, we did a flag off of the breastfeeding week, where our expectations were to, outshine the country that did that had the 30,000, the highest number of breastfeeding women at a particular time in a minute. And our target was 32,900, but we made 31,250. I think that's the number. And we're number 1 in Nigeria. We had
that's amazing.
Those number of women across the nation breastfeeding babies between the ages of 0 to 6 months, breastfeeding in a minute. Fantastic. It was such a beautiful moment, and I was just jumping up and down, and so that was it. We've been visiting clinics, sensitizing, women on the benefits of breastfeeding. We also visited the some IDP camps across the nation. So we're still visiting hospitals.
That's a lot of work.
People. Yes, we have.
Ebenezer, I want to add something to that.
We're going round and round the country.
So I'm smiling.
Yeah.
Yeah, so I mean, it's a very interesting thing to watch. I was there with Chioma when we had broke this world record. I think the last record
we broke
was
the record.
set
That's
by
also
Philippines.
unbelievable.
19,000, women were assembled and breastfeed simultaneously. But Nigeria targeted 30,000, and we were able to do that 31,000.
31,000.
So we are set a new record right now globally. So we're Guinness Book of Record. Nigeria is a Guinness Book of Record. So we have that, and it's all about galvanizing actions and support for breastfeeding, because sometimes people feel shy. They thought that it's something that is strange, or maybe something that should not be done. Sometimes people, they look at you at your age, you are still breastfeeding. It's a gift.
Yeah,
and it's
yeah.
Like I don't understand.
Right. So there's a whole lot that still lined up, within this week to support breastfeeding. Thank you.
So in my religion, it is encouraged to breastfeed a child up to 2 years.
Yes.
And I tried it for my first child up to a year, 4 months. And I got the comments, this one, you see they breastfeed as your leg long reach.
Oh, after somebody will go and play with sand, come back and come and remove.
So my son will just come and say, Mommy, sit down, sit down, sit down. And so at a year, 6 months, it was too long for my friends.
So my mother had that as well. But the last child, my brother, would go to school and come back. And he won't even talk to her. He just remove the load. He said, Miss Mom, it's my own.
Yes. Are you for real?
Yes. And I just...
He's all grown up now, don't you?
Yes, he's a father now.
He's watching,
And then, we know that the benefits of breastfeeding cannot be overemphasized.
Yeah. Let's do it.
Yes, let's do it.
Yeah, fantastic. I think that's all we can take. Thank you so much, Mr. Ebenezer, for joining us.
Yeah.
Any final words?
Thank you for
Any final words from you before we wrap up?
So, I mean, let's protect, let's promote, let's support breastfeeding.
Yeah.
Let's take out water for the first 6 months. All that the child needs is right there in the breastfeed.
Okay.
It will just save us a whole lot and keep children from dying. Thank you.
Thank you so much. Chioma, final words from you?
Yeah, I think that's Mr. Ebenezer has said basically all, but my passion is support, for the woman who's breastfeeding. Yeah.
That's all we can take on today's show. Thank you so much for joining us. Have a great day. We'll see you tomorrow. Bye for now.